I'm Michael Scott. I'm the Medical Director of Indian Healthcare Resource Center. I started here in September of 1995 and have worked here off and on for, well, the past 19 years. I'm a medical doctor, graduated from West Virginia University. I actually have a tribal affiliation too. I'm a 16th Delaware. I went into medicine to work with underserved people, although not necessarily in the United States. Initially, I looked to do missionary work, and that's part of the reason why I've worked here less than 19 years, although I was hired 19 years ago. So for 4.5 years, I was in South Africa on a couple of different stints, and was welcomed back here each time. And then working here, working with the different tribal communities, and definitely in urban Tulsa, there is as much of a third world need for medical care for the patients we serve as there is for a Utica Park down the street.
I am Jessica Gilmore. I'm originally from Arkansas, actually. We moved around a lot when I was younger because my parents worked for the Indian Health Service. And eventually we landed in Tahlequah, Oklahoma, and that's where I lived for most of my formative years. Graduated from Tahlequah High School, went to the University of Tulsa for undergrad. And then it was pretty much my first day there that I realized that I wanted to do medicine. So after that, went to the University of Oklahoma for medical school, and then OU here in Tulsa for residency. Okay, then turn around and come back. I became a doctor because my parents made it look like fun. They are both primary care doctors, and I grew up kind of watching what they do. And it just always seemed like the best possible thing that I could do. And I was really interested in it, and they tried to talk me out of it because they said medical school is really hard and residency is really hard, and they were absolutely right, but they could not talk me out of it. And so since then they've been very supportive. And I always wanted to give of myself. I wanted to take care of people. I'm an oldest child, so I do that a lot already. I really wanted to take care of people. I decided to start my career with the Native American community because I feel very strong ties to the Native American community. I am part Chickasaw, and my family is from Ada, Oklahoma, and I grew up with that as a very strong emphasis in my background. And because through my parents' work, I saw the great need that there was within the Native American population for quality medical care. And I am so privileged to be able to work here, right here in Tulsa, where I love living, to provide those services.
My name is Valerie Howard. I went to OSU residency for internal medicine, and I've been living in Tulsa for the past 10 years. I decided to become a physician and specifically go into internal medicine because it's adult medicine only. They have a lot of chronic conditions that take a lot of time and care. As an internal medicine physician, I feel like I often have to give patients the worst news of their life, and I might see them on the worst day of their life. And over time, we work together. I try to help them physically, mentally, emotionally, and over time through constant lab work, medication changes, supportive care, referrals to different physicians, hospital stays. After all that time and effort we put in together, hopefully we get to the point where I get to be the bearer of good news and might see them on the best day of their life. And those days are the reason that I became a physician in the first place. I am with the Wyandotte Nation tribe up in Wyandotte, Oklahoma, originally from Canada actually. So they actually gave me a lot of money during undergraduate school, and then I also received financial support through medical school, and decided to just help pay back because they were very supportive throughout my entire career. So.
My name is J.R. Hurt. I'm the COO for Indian Healthcare Resource Center, or IHCRC as I like to reference it. And my background is I actually started off clinical back in 1989. Went into sports medicine simply for the fact that I tore both ACLs playing football in high school. And next best thing, since I couldn't play college ball, was to go in sports medicine. And you know, it was a wonderful career doing clinical, treating patients, providing physical therapy type services for athletes, work comp type patients, and initially at Eastern Oklahoma Orthopedic Center here in Tulsa. And really loved the patient interaction. And you know, I did that for about 7 years, and was able to, you know, my last goal in sports medicine was actually to start a sports medicine program. And I was afforded that opportunity in 1997 when I moved to Monette, Missouri. And so came back home and got on the business side of healthcare. And I knew that leadership was kind of the direction I felt like that I needed to go. But I also knew that I needed to learn different aspects of healthcare, because I understood the clinical side fairly well. But I needed to know more from a business development, revenue cycle aspect. You know, there's a full gamut of things that outside of the clinical arena. And so I was very fortunate and blessed to have worked with an organization that afforded me that opportunity. As a Cherokee tribal member, I started working for the Cherokee Nations in 2012. And the goal was to help my fellow tribesmen by increasing revenues through our contracts, work for Cherokee Nation businesses. And I really enjoyed doing that, and I was blessed to be able to do that, and we were blessed with a ton of success, a significant amount of success in doubling revenues in a little over a year's time frame. And the Cherokee Nation businesses, they gave 30% of their revenues back into the health and education for the Cherokee tribal members. So knowing that I was a part of that was very beneficial and very rewarding, but it wasn't my passion. My passion was in healthcare. My passion, what it did teach me though was that I really enjoyed working with Native Americans and making a difference in Native American lives. And so, you know, the opportunity to join the IHCRC team in this role to make a positive difference, not only with our patients, but with our employees as well. You know, my goal and as I challenge our team and the different teams that we have throughout IHCRC, you know, I want people to leave knowing, or leave better because I was in their life than when they came into their life. I want them to be better because of me than worse. And so, if each one of our team members takes that mentality, that the patient leaves better for having come in and seen us today, there's nothing but the sky for us.
Hi, my name is Tanya Kane. I am a registered nurse. I am the clinic administrator here at Indian Healthcare Resource Center. I've been here since 2009. I got into nursing many years ago. I went straight from high school into nursing school. My mom said that you need to always be able to take care of yourself and support yourself, and what seemed natural was we had always had grandparents. There had always been family members for us to take care of, so it came natural, and I enrolled in nursing school. I've been out of school since 1982, and I am a proud member of the Cherokee Nation. Why I chose a career here at Indian Healthcare, I wanted to give back to my people, to all Native Americans. I've been very mission driven. I'm very fortunate that I've been able to work in that capacity. I want to be a help to my patients. I want to be an advocate. We serve over 18,000 patients here at the Indian Healthcare Resource Center, and it's difficult to make sure that we get everybody in. Most days we can't, but we try very hard. We have to look at the processes to change those, to make them better, to improve access for our people. Those are just some of the things that are important to me.
The past 2 years, Indian Healthcare Resource Center has embarked on a journey with establishing a medical home for our patients. Current trend in medicine, but also good medicine for our patients. IHS has a program called Improving Patient Care, which is their variant of medical home. So it started with our pediatric department about 2 years ago and now has spread to the whole medical department. What it means is that when a patient comes in to see someone here, it's not just anyone that they see. They see the same medical assistant, the same case manager, the same provider, whether it's a physician or a physician assistant. They work with a team and get to know that team. We also have expanded that to include referral specialists and pharmacy people. So it's spreading through the clinic so that the patient, when they come here, they know what they're getting and they know who they see. Being comfortable with your care really goes a long ways to helping you be well in the process. With the medical home, patient being comfortable here, we would also like the patient to be able to get all of their care here. At the current time, we're a primary care outpatient clinic, and we have a lot of other services that you won't find at another primary care outpatient clinic. We would like to expand that. Things like adding ultrasound capability. We have the machine, we need the person. We're working on it. We would like to add physical therapy. Well, we've got property across the street to build a wellness center. We would like to add other subspecialists, maybe cardiologists, urologists, the things that we can't readily get patients to for various reasons. It would be nice to have those in-house so that you walk them down the hall versus send them out of the building. So the expansion of the clinic, based from our CEO and her, really what she's built here, that's just the next logical progression for this clinic to expand services to be beyond just a primary care outpatient clinic.
We want to make sure that every aspect of the visit is a good one. And that's why getting them through the door is critical, helping them to get through the door. And so after much conversation, much discussion, much research, we've decided that utilizing a blended schedule, part of it open access, part of it scheduled, is what's going to be optimal for the patients and the providers long term. And Tanya Kane has definitely been a benefit in pulling this together and coordinating it, pulling the data together.
Our new blended schedule is going to consist of some patients having appointments, and that will be at the provider's discretion. 60% of the appointment slots will be, you are sick today, you'll call and get an appointment today. You need a well child check, you need a diabetic check, then you can call and we can put you in the next day. And hopefully that will, in the long run, once everything's situated, will provide better access for all of our patients.
One of the things we take a lot of pride in, and it's part of our measurements, that GIPR measurements, that's the government requires, is a continual improvement model. And as part of that, biannually we do patient satisfaction surveys. And in June we'd sent out we'd actually received a little over 1,600 responses. And first and foremost, we listen to that. You know, we look forward to those comments, and you know, I thank the people for taking the time to respond to those. That means a lot to us. If we're going to get better, we can't do that if we're not hearing what areas we can improve upon. The growth that we need to see at Indian Healthcare Resource Center is in being able to provide services. With the challenges of reduction in healthcare spending by the government, the increase in the need by Native Americans nationally, and plus we're seeing that constraint on our sister facilities or like facilities in the rural areas. We're having more and more Native Americans come to our facility, and unless we have more resources, we're unable to provide all the services they need. So the goal is to identify what our immediate resources needs are, how do we meet those, whether that be through financial billings, whether that be through donations, whether that be through additional IHS funding. And so the goal is to identify what those true needs are. Medical, is it another physician? Is it a family practice physician? Is it a nurse practitioner or a physician's assistant? Secondly, or it could be a specialist, a rheumatologist, endocrinologist. There's a variety of information that we are, at this point, we are looking at to determine what is our next step to provide valuable resources. We'll be looking at potential growth and enhancing our campus as we look at building a location on the north lot of our facility here. That would enable us to increase our dental department and add additional dentists. We'd also add additional optometrists to increase our capability to provide care there. We are currently underway of looking at adding an additional psychologist and psychiatrist to our behavioral health so that we can better meet those needs.
Our physicians are here to help take care of you, the patients. Our case managers, they're here to help you navigate the system, to help you find your way, to make sure you've got those services that you need and to get you connected with the places you need to be connected.
I've been very fortunate to work with a lot of good people. And honestly, it starts with getting the right team together and then get out of their way. And yeah, every team has to have a leader, has to have a coach. And I feel pretty blessed and fortunate to be part of that here at IHCRC. And the key is listening to your patients, listening to your employees, and looking for ways to continually improve, that continual improvement model and continual growth model, whether that be as individuals, whether that be as a team, whether that be as in patient care. And that continual growth model is a continuing learning concept that there's always, there's changes that come out in disease management. Are we up to date on that? We want to make sure that our teams are. There's changes in leadership as far as methodologies and approaches. My biggest attribute is leading in a servant leadership role. Don't ask, go with. Don't say charge the hill, lead them up the hill. And being able to do that has, and knowing that I'm just part of a team has been critical to my success, and I think it's going to be critical to success here for the future.